Menopause. What a change in a woman's life. I was a medical student when I first witnessed someone with debilitating hot flashes and sweats. It was my mother. She was in her early 50s, suffering in silence, overloaded with juggling the competing demands of running a business and looking after her family. It was very sad that she felt unable to talk about it because the norm was just to put up with it. As a young doctor, I saw colleagues denying treatment to women. I felt often there was a lack of empathy because the menopause is part of being a woman. It's not life-threatening. It is not a disease. To make matters worse, in 2002 came the era of studies such as the Women's Health Initiative and the Million Women that made scary but very catchy headlines on the breast cancer and other risks associated with HRT. Fast forward 30 years from my mother's experience, and it still surprises me how little some of the confusion, the myths, and the attitude around the menopause has changed. Somehow the menopause remains a taboo, and more than ever, it carries the dreaded perception that we're getting old in a society that celebrates youth and neglects maturity. Having said that, there has been some change in recent years, with celebrities coming forward about the symptoms and positive media presentations on the benefits of HRT and the flaws of the studies that scared doctors and the public 2 decades ago. However, I still see patients who are confused on how to manage the menopause or worried about the use of HRT. Who can blame them? There is contradicting information on the HRT risks, especially for breast cancer, confusing terms such as bioidentical and body-identical HRT, and so many alternative methods that one doesn't know where to start or what is really safe. No wonder the frustration, fear, and needless suffering continues. In 2018, I set up the Medical Prime Clinic to materialize my dream of helping women manage this sensitive period in their life. With the current life expectancy reaching beyond 80, a woman may be menopausal for more than a third of her life. This is not an insignificant part of one's life. The clinic continues to grow, and we are fortunate to be in a position where the team and I can speak about the menopause to women, men, thought leaders, and organizations. Together, we can make a positive difference to the understanding of menopause and the health and well-being of women.